Now let's turn to the latest on the coronavirus as we near the staggering 100 million cases worldwide, with more than 25 million here in the United States. And concerns about those variants are growing. Let's bring in ABC News contributor Dr. Todd Ellerin to break down the latest for us on coronavirus. Okay, overnight I know we learned about this new Brazilian variant that has now been discovered here in the U.S. in Minnesota. What should we know about these variants? We keep hearing that they're more contagious, that they're more easily transmittable. Should we be concerned about that?
Hi, Eva. Of course, we need to be concerned about that, because anytime we have more contagious variants, we're going to lead to more hospitalizations and more deaths on a population level. But remember what's important. We cannot monitor what we don't measure. So what we need to do in the United States is increase the measuring of these variants through genetic sequencing. So we have to sequence and we have to share with other countries, just like we're seeing the UK, South Africa, Brazil do to us. Remember, the country in the world that has the most transmission is also going to have the most variants. Unfortunately, that's going to be the United States.
Well, and viruses are known to mutate. That's what viruses do, right? So the question I think a lot of people have as they hear about these new variants is how effective are these current vaccines that we have on these variants? And we're hearing Pfizer, Moderna both looking at working on potential booster shots in case they need that. What should people know who have either gotten the vaccine or they're signing up to get the vaccine?
Right. Well, good news so far on that front. In the lab, it looks like both the Pfizer and Moderna vaccines have a good immune response to the UK variant. Now, Moderna just gave a publication, essentially a press release, saying that against the South African variant, there was about a 6-fold decrease in immune response. So that is suboptimal. They still think it's enough that's going to be able to protect us. But remember, I'm telling you about the lab experiment. We need to know about the real life experiment. Good news about the RNA, the messenger RNA type of platform is that we're able to change the viral construct so we can check and adjust to other variants. So Moderna is already looking towards new constructs that will be tested again. But so far, it's still only the 2-dose regimen with both Moderna and Pfizer.
Yeah, and that mRNA technology, something they can adjust quite quickly when you think about vaccines and developing them. This new administration has said the race to vaccinate is obviously at the top of their agenda. What are you hoping that you'll hear from the federal government? What do you think their focus should be at this point?
Well, I think we've already heard a lot from President Biden, and I think he has the right message. I think he's the right messenger. And, you know, we're hearing about improving the staffing, improving supplies, improving space. What also has to happen, of course, is improved communication and coordination. What we're hearing is that states are only hearing about an unpredictable amount of vaccine that they're going to receive with about a week's notice. And then remember, the states have to call the clinics and hospitals, pharmaceutical chains, to tell them how much it's going to be. We need more leeway so that we can coordinate this better. The other thing to remember, we want the companies to churn out more vaccine, but remember, they're working really hard. We still have to make sure that that final product doesn't compromise quality and safety. So I think we need other companies to get into the market. I'm really hopeful that the J&J results are going to be robust so they can enter the market as well.
Yeah, and we should hear back about those results here sometime in the next 2 weeks. That is a 1-dose vaccine, which is very promising to see come on the market. Dr. Fauci has raised some concerns about the disproportionate availability of those doses of vaccine that are out there, saying that some of the areas of the country where there is supply of the vaccine, but the systems aren't in place to distribute it. It seems like it's all over the place. How much is supply the issue right now?
Right, there's so many logistical challenges. I mean, one of the issues is in certain places there's not enough supply. In other places there's still vaccines on the shelf, perhaps because there's still that administration gap. They don't have enough administrators. Perhaps some of the patients that they were expecting to see have been vaccine hesitant. So I think there's a lot of logistical challenges. We are doing better. In the beginning, for every 3 vaccines that were being distributed, only 1 was going into a person's arm. Right now it's about about 2 to 1. So we are improving that administration gap. So we do have to, optimize that. And of course, we need to get more vaccines into the market.
Yeah, those precious vaccines so needed right now. Dr. Todd Ellerin, always good to talk to you. Thank you.
Take care, Eva.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.